Welcome to tonight's episode of The Farm Show. If you've tuned in to see the latest developments in animal husbandry, you're in the wrong place. We aren't talking about that type of farm, partner.
You mean this ain't the farm show? Wilbur, I thought we were coming to see the animals like the pigs and stuff. Well, I guess we're just gonna go home.
Yeah, tonight's special guest on the show is Morphine. Y'all know what time it is. Here's your host, Polly Pharmacy.
Yay! Thank you, everyone, and welcome to tonight's episode of The Farm Show, where we go in depth to discover medicine's true nature. Please help me welcome tonight's guest, Morphine.
Woo!
Welcome to the show, Morphine.
Thanks for having me, Polly. I am so excited to be here.
So, Morphine, how did you come by your name?
Well, Polly, it's actually an interesting story. I'm named after Morpheus, the Greek god of dreams. And to patients who really need me, I am a dream. I am the morphine fairy.
So what are your therapeutic uses, Morphine, and why are you so dreamy?
Well, my main use is for pain relief, from moderate to severe pain. Like most other drugs in my family, I share the "in" suffix. We all have varying degrees of effectiveness. We are considered a narcotic opioid. When I am administered, however, I also tend to cause drowsiness, mental cloudiness, reduce anxiety, and create a sense of well-being. I can relieve pain without affecting the other senses, and my patients can retain their consciousness. I am most effective against constant, dull pain.
How do you do that, Morphine?
Well, Polly, I mimic the actions of endogenous opioid peptides, enkephalines, endorphins, and dynorphins. I bind to the same receptors in the CNS, the brain, and spinal cord that are associated with the perception of pain. I have a physiologic role as a moderator of pain perception, and I produce analgesia by mimicking the opioid peptides.
Cool, that sounds amazing. Are there any adverse side effects related to your use?
Oh, well, the main problem I cause is respiratory depression, which can lead to death if I am not counteracted. But superhero Narcan likes to follow me around and reverse my effects, though. I can also cause constipation, orthostatic hypotension, urinary retention, cough suppression, biliary colic, emesis, elevation of intracranial pressure, euphoria, dysphoria, sedation, meiosis, birth defects, neurotoxicity, and prolonged use can cause hormonal changes and suppress immune function.
Well, that seems like an excessive list.
Yeah, I'm not proud of it. I also have a bad habit of causing tolerance and physical dependence, which means I am a subject of abuse in patients that misuse me.
I don't really know what to say, Morphine. It seems maybe you aren't the nice gal I thought you were.
Oh.
Are there any people who should avoid you?
Oh, I'm not really that bad of a drug, Polly. But yes, there are folks who should avoid me. People who have a decreased respiratory reserve, like asthmatics, should avoid me due to my ability to depress the respiratory system even further. I should not be used in labor and delivery because I can cause problems for the neonate, which can lead to dependence. I should also be avoided by patients with head injuries because I can exacerbate the symptoms. I can also cause problems for patients with inflammatory bowel disease, liver impairment, hypotension, prostatic hypertrophy, and patients in elderly.
That boggles my mind. Maybe if you explain how you work, it would clear up why so many people should avoid you.
Sure, Polly. I'm administered via several routes: oral, IV, IM, sub-Q, epidural, and intracathal. My effects are slower when I'm given orally, though. When given IM, IV, and sub-Q, I can last 4 to 5 hours, providing analgesia. If I am given epidural or intracathal, my effects can last up to 24 hours. When given orally, it depends on the dose formulation, either IR or ER. I can last 4 to 5 hours or up to 24 hours. But oral dosing passes through the liver first, and most of the drug is inactivated by liver enzymes before it is even available for systemic absorption. The parenteral doses must cross the blood-brain barrier to enter the CNS. I have poor lipid solubility, and I cannot cross the barrier easily, which means only a small fraction of my dose binds to receptor sites. Once I am metabolized, I'm excreted in the urine.
That makes a little bit more sense now, Morphine. Do you have anything further to add for our viewers?
Depending on how I am used, my effects can either be beneficial or detrimental. But for patients in pain, I am the go-to drug for relief. And if I do happen to become toxic, superhero Narcan always has my back.
Well, thank you so much for stopping by, Morphine. You have given us a lot to think about.
Thanks for having me, Polly.
Oh my God, Morphine, what have you done to Polly?
Oh no! Oh, where's superhero Narcan when you need her? Narcan to save the day! Yay!
Woo!
Thank you, Narcan.
Yeah!
This has been The Farm Show, brought to you by Team Ramrod.